Are you an athlete? Are you training for your first 5K? Maybe you're training for a marathon or you're doing a triathlete this summer. In any case, it's important to remember how to stay hydrated. It's equally important to remember that too much water can be a bad thing, and that's what we're going to talk about today.
Awesome. Well, first of all, I want to thank my special guest here, Dr. Nick Sterling, for joining me. All right?
Absolutely.
He happens to be my son, so this is really cool. And so thanks for watching today. This is a really interesting subject for me because I'm out there running a lot and things like that, and it's been 95 degrees lately. So this is our subject today, happens to be exercise-associated hyponatremia. And
So
tell us about
EAH.
this. Yeah.
So that's what we're going to talk about today. So EAH, exercise-associated hyponatremia. This is on the opposite end of the spectrum of underhydration. So this is usually associated with hydrating too much. On one hand, we have media. For the last few years, we have fitness experts telling us, hydrate and hydrate and hydrate some more. And, we see like increased hydration stands and water stands during races. They're becoming more frequent. So, we have this emphasis on fluid intake. But at the same time, we hear these reports of marathoners or ultra men, ultra women who have gotten seriously injured or hurt. Maybe they ended up being in the hospital or going into a coma. Worst case scenario, even dying due to this thing called EAH, which is exercise-associated hyponatremia.
Yeah, I've heard about that, and it's kind of disturbing actually. So obviously we want to strike a balance. We don't want to be overhydrated or underhydrated. So how do we go about two things? How do we go about establishing a balance between those two things right there? So overhydration and underhydration, and then how about electrolytes and how they play a role in all of this?
It's an important question, and it can get to be a complicated topic. The first thing is to step back and know what it is. What is EAH, or simply hyponatremia? This is different than the hyponatremia that you would encounter in like a chronically ill person. So that's the first thing, is remember that this advice, or this is not medical advice, but these principles would not apply to someone who's like chronically ill. So this is associated with athletics and exertion. This is what we're going to talk about. So EAH is an imbalance between salt and water in your body. There's too much water, there's too little salt. And usually this can happen in a couple of different ways. So the first way would be like during a short duration sporting event. So the way that this would happen is maybe you're going to go out there for like an hour. This is like the basketball game of the season. You're just going to like crush it, or maybe you're doing some other short-term athletic event, and you end up like hydrating a ton, like having 10 bottles of water before the sporting event. So when you have that water, you're essentially diluting the salt out of your bloodstream so that you end up with a lower concentration. Also commonly, you can get EAH with a longer duration sporting event, such as like a marathon, or like anything beyond like 2 hours. You have some additional effects kicking in, so additional processes like ADH, which stands for antidiuretic hormone, and this is essentially the opposite of caffeine. In fact, caffeine blocks ADH, so we all know caffeine makes you pee a lot, right? So ADH does the opposite of that. It usually makes you hang on to water. So when you're out there, as a part of your normal survival mechanisms, ADH kicks in and you start to hang on to your water so that you don't get overheated and dehydrated. And that's normally a good thing. But if this is in combination with you stopping every 15 minutes, 20 minutes and at the water stands and having a couple glasses of water, you may be approaching that kind of territory where you start to worry about EAH. In addition, in these longer duration events, especially if it's hot out, it's a little unclear right now, the research, as to how much losing salt through your sweat can contribute to this, but that is thought to be an additional factor contributing to EAH in longer term sporting events.
All right, so let's say I'm out there and I'm riding my bicycle like crazy, or actually for me it'd be more like I'm running. That's when I really feel like I'm putting forth a lot of effort. How am I going to know? How am I going to feel if either one of these is happening? Let's say I have dehydration, or let's say I have overhydration. How do I know?
So yeah, and the first thing to remember is that many of the symptoms of underhydration or heat exertion related illnesses or an EAH can all overlap. So first of all, you don't want to be out there trying necessarily to figure out which one you have and try to diagnose yourself. You really want to just kind of take it easy, maybe get medical attention. But basically, you may start to feel something like, with EAH, you may start to feel a little bit dizzy, you may start to have a headache, you may feel a little bit nauseous. You may feel a little bit mentally foggy. That's an earlier sign. If you start to be more confused, that's a little bit of a later sign. If you start to vomit, that's a little bit of a more severe sign as well. And if you have abdominal pain as well, that's not really a good sign. Worst case scenario, this can lead to like a seizure. It can also lead to a coma, and you don't want to be out there pushing it, and drinking more and more, and then be out there all alone on the track or wherever you happen to be, and you were trying to figure this out, but you didn't get attention soon enough. So just seek medical attention if you have that. But on the other end of the spectrum, we talked about underhydration, right? So a lot of the same symptoms apply. You may be dizzy. You may have some muscle cramps. Maybe you have like flushed skin if you're having a heat exertion kind of picture, like maybe heat exhaustion or heat stroke. So those are things to worry about too. That's why I want the focus today actually to be on prevention. So, in terms of preventing.
Hey, what can we do? That's my next question. What can we do to prevent?
So to prevent, a couple principles apply. The first is to know your body and know your limits. We're all, biologic machines, and we have certain limits, right? So if you're not used to being out there in 95-degree weather, if you're not used to the humidity or sweating a ton, don't jump into a situation where you might get stranded. Because either one can apply. You can have a heat exhaustion or heat stroke, or you can also have EAH kind of picture. So that's the first thing. And then the second thing is that when you're hydrating for these events, you do want to hydrate because it's more common to have dehydration than it is to have EAH. But you don't want to go out there and pregame with like 10 bottles of water. That's just going to be too much. So you want to pay attention to your hydration status so that you're not dehydrated. And one of the ways you can do that is just based on your urine output. If you're starting to pee a little bit more frequently, or like if it's starting to go to more like a clear color, that means you're approaching kind of that limit where you may not really benefit quite all that much from additional fluids. Also, your veins, if you kind of look at those, and if they're flat, maybe, and they're usually not so flat, like maybe you are a little bit dehydrated, you need a little bit more fluids. But don't drink like 10 bottles of water in the first hour, before you go out there. And then when you're actually out there in the race, you don't want to be like stopping at every water stand all the time, drinking like 4 glasses of water. That's probably going to be too much. What they found in the new 2017 guidelines, which I will put the reference down in the description, what they found is basically people who approach 1.5 liters per hour or more, those are the people who are at risk for EAH. So you want to stay, it's per hour during the sporting event. This is not necessarily before, but so it would take a lot, to approach that. You'd really have to be pretty busy, having a lot to drink during the sporting event. But in any case, just kind of watch that. And then lastly, there are those of us who are just going to go out there and do this anyway. Like you just know, like it's your favorite thing to run on a hot day. Maybe you are training for a marathon. You don't want to interrupt your schedule. So if you know that you're going out there and you're going to be sweating a ton and losing a lot of salt through your sweat, and you're also going to be losing a lot of water, you want to try to compensate for that in some way and prepare for that in some way. So like Gatorade, I think some other companies do sell packets. I do have one here. I don't have any affiliation with Gatorade. This is just an example. They're like these packets of electrolytes that you can buy, and then so it's basically salt and fake table salt, so potassium chloride, and then like some magnesium. You can just put that in the bottle, and when you do this, it's going to taste terrible. It's not going to taste like the stuff that you get at the supermarket. The reason why is this is going to have a much higher concentration of electrolytes than anything you could get at the supermarket. For some reason, we bought into the idea that if we get smart water or, certain over the, like grocery store types of like Gatorade, that we're going to get the electrolytes that we need because it says it right on the bottle, right? But if you actually look at the content, like the sodium content, you need to drink like at least, 20 per day of those minimum, sometimes even like 50 of them per day to even touch, what you would need and what you would lose through your sweat losses. So those are not going to cut it. If you're going to be the person to go out there for hours and hours on a really hot day, it's something that you could, at least consider, doing that and really packing in those electrolytes. It's going to taste like ocean water, but that's just kind of, the price that you kind of pay. So again, none of this is medical advice, but these are principles that can apply to athletes when they're out there. Things just to remember, to stay safe out there and not to underhydrate, but also not to overhydrate. It can be a tricky balance.
So it sounds like if you did drink all those 20 bottles you might need, let's say it's 20, you might be overhydrated.
You would probably be overhydrated. Exactly.
So you don't want to do that, right? That's kind of what we're talking about here. So I want to go back, though. I want to visit one.
Sure.
We already kind of touched on it, but because there's a lot of information here in a short amount of time, what are the dangers of let's say, EAH? Let's talk about the most imminent dangers.
That's a good point. So what do we worry about with EAH? Fortunately, again, this is low sodium, low salt in your blood, right, and too much water. Fortunately, most of these cases are mild, and you just have the symptoms, and then you go to get medical attention, you stop drinking, or you drink really salty water, and then it corrects, so mild. But if you don't get treated, or if it's too severe, the concern is basically brain swelling. Your brain can swell up within a confined space in your skull, and when that happens, you can have mechanical disruption of the tissue. Worst case scenario. This doesn't happen often, but we do hear handfuls of reports of this happening in permanent neurologic damage or death. So it's a serious topic. It's one of those things where you want to balance, because you don't want to be so afraid of this that you don't hydrate enough and then you put yourself at risk for the more common underhydration or heat related illnesses, which can carry their own issues as well. So it's a balance to strike.
So, and I know this is probably common knowledge to a lot of people, but there's some people who may not know. Just real quick, can you touch on dangers of underhydration?
Sure. I mean, essentially the dangers of underhydration would be leading to like heat stroke, worst case scenario, so heat exhaustion, heat stroke. If you're an athlete out there and that happens, they'll probably try to hydrate you. They'll probably dunk you in some water, or maybe they'll take the Gatorade thing, with the ice cubes and splash it over you. The goal is just to cool as soon as possible. But, essentially, you may be familiar with when someone has a fever, right? When they're sick, why do they have the fever? Because you're essentially trying to denature the proteins or change the conformation of the enzymes or proteins that make up your cells, and in this case, the viruses, proteins. With a heat exhaustion or heat stroke kind of picture, that's the concern, is that you're essentially going above the temperature at which your body can function, and those physiologic processes can no longer take place at that kind of temperature, and so you can have also neurologic damage from that. Underhydration in itself can lead to elevated heart rate, and someone who's at risk, you can have heart issues because of that as well. So generally what we're talking about would apply to healthier like athletes, that type of thing. So again, not medical advice. But these are just kind of principles that you can think about.
All right, so I have two more questions before we wind up, and one of them that I'm going to ask now, I didn't say I was going to ask it, and that is, do you have any recommendations on whether it's body weight or gender or age or anything like that, or level of anticipated output ahead for somebody? Do you have recommendations on how much they should drink before they do their thing, whether it's the day before or an hour before, things like that?
Yeah, and it is a controversial topic. We've all heard that we need to drink 8 glasses of water per day, and the research now is kind of making that, putting that, in question. So I can't make any recommendations, but what I could say is just listen to your body, listen to the signs of, underhydration or overhydration, So I would just say, just try to listen to your body. If you, are about to go out there and you're not peeing a whole lot, or it looks like really concentrated, or if you're feeling lightheaded when you get up from a chair, that can be a sign of that you're not getting enough water. But so I can't make any official recommendations, but just listen to your body, I would say.
Well, that's a good rule of thumb to follow for pretty much everything we do.
I think it is. I think it is.
I like that. Okay, so my last question is this, and I know there's a lot involved here. We have a ton of information. It gets really complicated, but if you could put out there one overall summarizing takeaway message, what would that be?
I think the summary message for today is that you need to strike a balance between potentially underhydrating and also the risk of potentially overhydrating. Just listen to your body. You don't want to do either one, but just remember there is a limit that too much water can be a bad thing.
All right. Well, cool, man. This is great.
You bet.
Thank you very much. I've been looking forward to doing this for many years.
Me too.
With you, Dr. Nick Sterling, my son. This is awesome. So I want to thank you very much for joining me. I want to thank everybody out there for watching, for listening, and stay hydrated, but not overhydrate, right? Thanks again for watching. Have a great